Hey y'all, we are live. I'm so sorry, y'all, that we are 1 hour behind because the time changed and I didn't know what was going on.
We didn't know it was changing.
No.
We
knew it was changing here. We didn't know when it was changing in the United
Y'all
States.
supposed to keep up in the U.S.
That's right. So one of the reasons we moved to Portugal, one of the reasons why we decided we had to leave the United States is because of the healthcare system. The healthcare system in the United States is broken. It is expensive. The outcomes are no better than most of the other countries, especially in the westernized world. And basically, in the United States, if you get into an accident or, God forbid, you get dementia or something like that, the thing about it is you're going to be bankrupt.
The system is not set up to really help you out because no matter what, they're going to take all your money and everything else you got to have.
That's right. That's right. You need to die in poverty in the United States in order for the government to help you. But Portugal's outcomes, Portugal is so far ahead. Is it number 4 or something like that?
I thought it was at least number 12 in the
world, right? And then the United States is way down there, number 30 something. 38. All right. See, my husband's got the answers. So we are going to get started. We have got a show for you. We've got 3 wonderful ladies who have had experience with the healthcare system here in Portugal, right?
Yep.
So, we didn't introduce ourselves. Hey, y'all. My name's Halisi.
And I'm Rick. Welcome to our Black Utopia.
On our channel, we talk about money, travel, and retiring abroad as we build generational wealth. So who are our special guests today?
We have 3 very lovely ladies that are going to join us this evening. Bev, who's been living in Portugal for a while, and she's a business owner and starting many different businesses here in Portugal. And you got Heather, Black in Portugal. I'm sure you guys have looked on the Facebook group and seen her.
Yep.
And we also have Shar. She created the Xpat app. That's Xpat. We're going to welcome them. We want you to welcome them too.
Yes, but first, if you're new to our channel, about 6 years ago, Rick and I had a wake-up call. We were getting close to retirement age, and we looked at our savings, and it looked crazy. Cray. But you know what? About 3 years ago, we got our financial act together, and we went from negative 22,000 to over 800,000 in net worth. So if any of that sounds interesting to you, please subscribe, hit that notification bell so you know every time we go live, and hit the like button. All right, let's introduce our ladies. Hey there, ladies. How are you?
How you doing?
Hi.
So I'm just going to go around as you appear on our screen. So Shar, why don't you introduce yourself?
Hi, everyone. Shar Winter here. I'm the founder and creator of the Expat App. We are a global community for the Black community that works, studies, and lives abroad. So happy to be here. Thank you for having me.
Love it.
Welcome.
Hi.
Go ahead, Bev. Go ahead.
You go ahead. Hi, I'm Beverly. I am a disabled vet, a retired vet, and I am the co-owner of Soulfinesse brand. And Soulfinesse is anything that finesses your soul. I am also a two-time triple negative breast cancer survivor that metastasizes, which is the worst cancer that a female and a male can have. I am also a stroke survivor, aneurysm survivor, and I tell you, I love living in Portugal. For cancer, Portugal's ranked 14, the U.S. is ranked 38.
So I got the U.S. part right.
See, there you go. There you go.
So
Heather. Thank you.
Thank you. Welcome.
Hi, my name is Heather Courtney, and I am also a United States disabled veteran that is also residing in Portugal. I am one of the co-founders of Black in Portugal. I am also the founder of the Lisboa Melanin Collective, and I am excited to be on this wonderful panel with all my friends and family here.
Hey, neighbor.
I hear you guys from the kitchen window right now.
Oh, that is funny. We are, like literal neighbors.
We're right next door to each other.
Open up window, your kitchen some days.
Right? It's just, it's kind of interesting that we moved all the way to the other side of the world. We only knew about 12 people here in Portugal and happened to move next to one of the 12 people that we knew. So I don't know what God's doing, but we're gonna work that out. So if you have questions for these ladies, put a Q in front of your question, because I know you guys like to chat, and I don't want to miss anything. So we are going to just go round robin. And Shar, why don't you start by telling your story in dealing with the healthcare system here?
Oh, yes. So my experience was with the private healthcare system here in Portugal. Last year in November, I had fibroid removal surgery. And for anyone who's not familiar with fibroids, they're mine is non-cancerous growths, like tumors that grow in the uterus, and it causes a lot of severe issues that I don't think we talk about enough in our community. Mostly, Black women are impacted far more than other races. One of the things that I learned from that experience was that extreme fibroids, or fibroids that are very large, can eventually cause heart disease. And that is because you are dropping your, the name is hemoglobin number so low that hemoglobin normally delivers vital oxygen to vital organs. And because it's so low from the blood loss from the fibroids, the heart has to work harder. And because your heart is working harder, that's the increased rate of heart disease. No one in the US ever explained any of that to me. So I kept them because I thought it was no harm keeping them. And at the time I was 36. Yeah, 36. And I was like, oh, they're like, as long as you're not trying to have children, it's no biggie. So I just kept them, and they kept getting bigger and bigger. What ended up happening though is my lifestyle started to just be really poor because of the fact of, like, I was always fatigued. I was anemic, had very low energy. Heather can attest to, I used to flake on events all the time because I would just wake up and have no energy. And because I was on a career break, I did not realize, I wasn't working. So I was like, I was running a business, that I started Expat, but that's different from like a 9 to 5. And so it got to the point where the bleeding became so excessive that I was concerned and started going to a doctor out here, which was recommended by another Black female expat. So shout out to the expat community that looked out. And after a series of meetings and, going through the health insurance, which I'll talk about that later. It's too much for the intro. I had the surgery in November. We initially thought it was 8 centimeters. It was 6 of them. The biggest one was 8 centimeters, ended up being 13 centimeters, so much bigger, which resulted in an emergency blood transfusion, and I stayed in the hospital for 4 days. But I had the best treatment. The doctor was phenomenal. My care was top notch, and I'm just really grateful that I was here. I can't imagine if I would have been in the States. They probably would have taken my uterus, to be honest, because I hear that I did a lot of research and talked to a lot of women, and a lot of Black women mentioned, who are around my age or older, that they went in for the fiber remover and left with a partial hysterectomy, meaning they took their uterus. So I say all that to say that I think sometimes people are afraid of medical abroad because they assume it's poor quality. And with the private system, that was not my experience. It was actually better than the treatment that I received in the States. So I can talk more about the insurance part of this, and what was covered and everything else, but I just wanted to give a kind of overview about my experience.
That's great. We will circle back around and talk about the money piece. Okay. Bev, you gave us a little teaser there.
Yes. With me, I'm also with private insurance. And before I got here, I was concerned. I am covered under insurance in the US. And thanks to Heather, so shout out to you. And there is another expat here as well. I'll mention her. Her name is Alfreda. Thanks to her, that I could have used my insurance from the military as well, which is Humana. So I have Humana for life. Um, I decided to keep my Humana for life. Well, it's for life. So if I have to go back to the US, I'm still covered with them. But I was afraid looking at other Facebook groups that said, well, if you have pre-existent health care, you won't be able to get insurance here. That's not true. I was able to get private health care because At the time, if you do not have the symptoms at the time that you're getting insurance, you can get the insurance. So I was able to get that insurance. I had, like I said, triple negative breast cancer twice. I had a massive stroke. I had an aneurysm. I flatlined. I also had a hole in my heart. I was diagnosed with dementia, the early stages of dementia. So I'm going to let it all out. I'm an open book, so get ready, guys. I've also, um, they found something in my lung before I came here. Then in April this month, of this year, they found something in my stomach. So when you have metastasizing cancer, it metastasizes everywhere. Um, I have, I was afraid. So we left the US because I lost several brothers to cancer. And coming here, I wanted to make sure that I would get the best care with doctors. My doctor that we found, she speaks English. And she was able to set me up with other doctors. So I have a team of doctors that all speak English. I am not with the two big hospitals here. I'm with the third hospital that is here in Portugal. And I have also a handyman, a concierge service that will come out to you and get you connected with the best doctor or healthcare. And I do go to the doctors quite often. I am also with the public healthcare, but I have not used them yet. I only do the private because I feel that I have not lived in Portugal and I don't want to uh, take advantage as I feel because I feel the public healthcare is for the Portuguese, and the prices are so minimal that we can afford it. So I had to have a pulmonary function test. I didn't know the doctors in the States gave me medicine. I didn't know, I don't look up my medicine. So I went to take the pulmonary test because I still have doctors in the States. And they told me that the price was $135. In the States, it would have been $13,000 for this test. I was so shocked. And they told me it's too expensive here. And I was like, they tried to give me all kind of counts to get it down to 90 euros. Okay, I'm all right. So I love Portugal medical system.
Yeah.
I love
Yeah.
it. I love it.
Wow.
Were you going to ask a question?
No,
Okay.
I'm just
I know.
blown away.
I know. I know. Heather.
Yes. So I am also a disabled veteran. So my story is a little bit different from Shar's and from Beverly's. I guess I could begin with I was active duty in the world's greatest Navy. And, I had to get that out with the world's greatest Navy. And, when you're in the military, you have to take vaccinations for different things, especially when you're deployed overseas. Well, one of the vaccinations I had caused me to have an adverse reaction. I had to take the anthrax vaccination and several boosters. And because I had an adverse reaction, I developed autoimmune issues. So originally, when I started having these symptoms, I just played it off, I'm deployed, the air, there's like 1,001 things, I played it off to. I went to medical. Medical said, nothing's wrong with you. Here's your 800 milligram Motrin, be on your way. And my symptoms actually kept getting worse and worse. I remember I had eye surgery done, PRK, which is kind of like LASIK, but a different version for people whose corneas are smaller. And I should have not been a candidate for that because I had this illness that I didn't know about. So because I had that surgery, I had issues with my eyes, like constantly. My eyes were bloodshot red. I struggled with a lot of depression during that time because people would always ask me, am I high? Am I crying? Just so many different things. So fast forward, so for 4 years, I not only had to deal with, red eyes, puffiness in my face, I also had to deal with chronic pain. And within those 4 years of being in the military, that time span, I was told nothing's wrong with me. I have chronic conjunctivitis. I'm perfectly fine. So fast forward to when I was stationed in Japan, I was still having the pain. I would, like, some days I would cry at work. My junior sailors would help me out in so many different ways, go get me food or like take care of tasks that I should have been doing. But, they saw I was hurting and in pain, and I had a really bad flare up. This flare up was more visible. It took over my entire body. It looked like I just had like lesions, but not open ones, but just red dots that had white parts on them. And so I went to the hospital on base, and they were asking me all these questions about, do I feel pain? Do I ever have, red flashes, red welts on my cheeks, my eyes? The answer was yes to all these questions. They're like, well, let's run some panels. We think you have an autoimmune issue. Long and behold, my panel came back. I had all these different issues, and it was really scary because I've never heard of half of these things before.
Right.
I also had to do another test where they had to cut open my lip and take out glands from my lip and send it back to the States to get a positive confirmation. It didn't hurt per se. I don't, the scar is probably gone. It's in the inside of my lip, but they take out, parts of your lip. And when I got that diagnosis back, it was a really shock. I think you should never Google things the doctor tells you because it's all going to point to you going to die. It literally will. So fast forward, I came back to the States. I did more time in the military, but it was getting so hard for me to do my job. I used to build bombs for the government. I used to teach kids all ordnance, and it's very demanding, and you have to be physically fit and, taking care of yourself in order to do this job. So I was like falling asleep at work, driving, zero energy. So I can relate to when Shar said that, she would make plans. Yeah, hey, I want to go out. But when that day came, you would be completely exhausted, so I fully understood that. So I ended up getting, I asked to be processed out the Navy when I was put up for a medical examination because I could no longer do my job. I had a daughter at the time, a younger daughter to take care of, and my health was way more important. But just to sum it all up, when the autoimmune issues I do have lupus, I do have Sjogren's syndrome, and I do have antiphospholipid syndrome, which also puts me at high risk of blood clots and miscarriages. So finding good healthcare was really important. One thing that I noticed that was really expensive is my blood work. Although, yes, I am covered by the military through TRICARE, which is also Humana. I also have VA healthcare. And also private healthcare here in Portugal. I just knew that I would have to find somewhere that healthcare was affordable, upfront cost, affordable. Blood work, I usually have to get done every 3 to 6 months. And that in the States, it was ranging from $2,000 to $5,000. And it's just multiple blood works that I have to get done. And I know within the autoimmune communities that I'm in, I see people struggling in the US. I can't afford to get these blood works done, which is really important, especially with some of the medications you take, because, one of them, you have to check your liver enzymes every so many months because they have to be in a certain, range in order for you to continue taking the medication. So that was very important for me. Also, access to my medication that was affordable. One of my pain medications was $364 just for 1 month's supply. And I did not have to pay all of that out of pocket, but I did have to pay a certain amount out of pocket because my medication was not in the military network, which is basically a list of authorized medications they want you to take because they probably get it cheap or free that they're trying to push on you. So that was also very important, and also quality care. I feel that a lot of times veterans do not receive quality care at these veteran centers. I, however, have been very blessed and lucky, but at the same time, I would have to drive 2 hours each way just to see a quality doctor that was civilian because the doctors where I was stationed at last in Gulf Coast, Florida, Destin, Pensacola area, did not have any doctors that were able to treat my conditions, or so they say. So they sent me to civilian doctors. So that's pretty much my backup story and how I'm surviving and thriving with medical issues here living in Portugal.
Thank you, ladies. Thank you so much. I'm going to take a break here because, it's a lot. And say hello to the folks who are in the community. We've got about 113 people watching right now. So hello, Phyllis, Margaret, Action, BJ, Auntie Trey, Shauna. These are the regulars. I love you guys. Anita, Greta. Hey there. You guys are always, always, always here. Linda Brown. That's a new name. It says, hello, Bev. Is that a friend of yours?
That's my cousin.
Okay.
And traveled here too. I did an interview with her in Mexico, but I see
love
she's
it.
I saw that interview. I saw that.
Oh,
Did you see it?
Yes.
I hope you liked it.
That's great. Hey, Rhonda. Good to see you. Vicky, Chandra, Angela. Another new name. Igami? Did we see that last week?
Greetings. Hi.
Yes. Welcome, welcome, welcome. Hey, Vanessa, Shauna, Barbara, Kimberly. We've got a lot of folks. Hey, one of my moms is in the audience. Hey, Janice. I got to give you a shout out. Creativity reigns. I love it. Nubianette. Hello. Wanda World 50 plus traveling lifestyle. Linda Brown, Pollyanna Sunshine.
Yeah.
That is definitely a new name. Welcome, welcome, welcome. Kenya, Professor. Hey there, Killer Queen. And Ron is in the audience.
Ron, my buddy.
Yes. Let's get to some questions because I did see some questions, and then we're going to circle back and start talking about the difference between private and the public system. Let's see. So I'm just going to say, while I'm looking, I know that there were questions really, really early so Rick and I are not yet on the private system, but we will be in a few days. And the prices that we were quoted for both of us are what we pay just for Rick's Medicare Advantage.
Mm-hmm.
And that's with pre-existing. So y'all, if you want to know one of the reasons why we chose to move to Portugal, that is definitely one of the reasons. Does anyone have long-term care insurance? Is that a thing in Portugal?
Long-term care.
So long-term care is when you need to when you really need assistance with everyday tasks. Like if you have dementia and you need to go into assisted living or a nursing home, if it gets worse, something like that.
Actually, I think because I have my insurance is through Allianz, and I have their best plan, and it covers everything. I wouldn't be surprised if that was covered. The thing with that private health insurance plan is the price is dependent. Your premium is based on your age.
Yeah.
And so I am 38 now. When I first got it, I was 36 or 37. And for a zero deductible, zero copay, I pay €100 a month, which is $1,200 for the year. But you have to understand that's zero deductible, zero copay. So when I had my surgery, which would have been around $6,500 without the emergency blood transfusion and other extra things that happened that weren't part of the plan, I paid $0, literally. I know it sounds crazy. I mean, I paid my premium, but I kept waiting for a bill to come because it was so unrealistic to me that paying, you know what I mean? I just kept waiting for the shoe to drop because in the US, it was always some bills coming after the fact. So,
and a few days in the hospital, that would have been about $50,000 or $60,000.
Oh, it was. I mean, the days in the hospital they did have planned already, but you know what I mean. It was all covered. And the key thing with the insurance that I think people should understand, and that I wish more people were aware of, when it comes to pre-existing conditions and when it comes to the grace period, I think it's important for people to understand that for pre-existing conditions, the way it was explained to me, as long as you can show that you've always had continuous healthcare coverage for the period that your symptoms first started, and you never had a gap in your coverage, when you come over here to Portugal, you need to apply to get a transfer of policy, not a brand new policy, because then They may not cover pre-existing conditions, and they also may not. They may give you this 12-month grace period, meaning that you may not be able to get help or coverage for certain things until after 12 months of being active. And that's a protection that they have for themselves, so people don't just come over here and use the system pretty much. So I understand why it exists. Yeah. But because I showed them, like, I've always had health insurance, I've never had a lapse. Even when I quit my job, I went on Cobra in the United States, which if you don't know about, please look it up. It is very expensive. But Cobra, essentially, if you work for a certain company, certain size company, they have to offer you to continuation of your health insurance. The only thing is they will no longer subsidize the cost.
Right.
So my insurance cost in the US went from me paying about $250 a month to $750 a month. I know that sounds crazy, but
It
when
is
I
crazy.
quit my job, I was paying $750 a month for my health insurance, and that was with deductible and with copays. So just want to throw that out there.
Right.
Yeah.
And for Dan and I, we have the highest insurance policy as well. So it covers everything. And there is no long term care policy extra. It is inside of that insurance policy. And we're 55 years old. And if there is, and I'll tell you how much we paid a year. So we paid 2,500 a year. And since the yen, I'm sorry, I'm going back to Japan. Since the euro to the dollar is equal right now as of today, so it is 2,500. But what is so good, if you have an issue, and there's only one doctor in the world, unlike the U.S., that can help you, you're covered for 1 million
Yes.
euros or dollar.
Yes.
So they'll fly you to that doctor.
Yep.
Wow.
So that's a good thing. And once again, Portugal.
Yeah. Definitely. Definitely. Go
I
ahead,
think we all
Heather.
have different insurances. I know Shar had shared previous about her insurance for pre-existing conditions. I know Beverly also had shared her insurance that she really, had good positive experience with. For me, I think I probably might have like the least amount of coverage for Portugal with Portuguese insurance. As far as a medical previous conditions, the wording can be kind of tricky sometimes. So when I did get my insurance, they did ask, are you sick right now? Do you have any issues right now? And at the time, that day, in that moment, I was feeling pretty great. So no, I did not have any issues at that moment in time. But I have a medium tier insurance. I pay 16 euros a month for 2 people. And my copays, I do pay for a copay, which is normally $35 for a visit. If it's an exam, I believe I was paying $25 for like an x-ray. It's not anything that would break the bank. However, what I feel is biting me in the butt right now is my blood work that my insurance is not covering all of it. Because these are a lot of specialty tests that the average person would not get to see, wouldn't get. But on the flip side, if I use my public insurance, as I was told, it would have been 100% covered if it came from the public doctor. But I was using my private insurance at a private hospital. So I kind of feel that if I had known that previous, then I could have saved a lot of money. I did come out of pocket a lot of money for these tests. I believe I mentioned to both of you, I paid like 600 euros, and that was with insurance for doctor's appointments, blood tests, and specialty tests that were not all covered with my private insurance. But everyone's insurance is a little bit different. Another reason why I did not get the top tier insurance is because I have 3 other insurances in the state. I have TRICARE, which will reimburse me up to a certain percentage. I have the VA, which will reimburse me 100%. And I also have Medicare as well. So even though Medicare you can't use here, but if I need to go back to the States for anything, I do have insurance there for that. I also have the military insurances as backup. So having to come out of pocket up front really does kind of suck. I really don't want to have to do that. But the fail safe is I am going to get reimbursed once I submit my claims.
Oh, that's good.
Yeah.
That's good. And so y'all know that if you're in our Facebook group, Fire Over 50, we are going to have Serenity Portugal founder in there. And so Bev uses Serenity. And some of these technical questions about the system at large, he will be able to answer. So for Rick and I, they did want to make sure, as Shar said, that we have coverage, full coverage right now. And so we were online, trying to print out our explanation of benefits and all of that stuff, as well as our historicals. So, so that's how you get around any of the pre-existing issues, right?
And I encourage, oh,
Go ahead, Shar, and then Beverly.
please keep track of your records, because it can be the difference between paying, like I said, I would have had a $6,500 bill because I had to get that surgery, and that 12-month grace period would have, put me into a whole year later. So please keep track. So I ended up having to contact my, and I also want to see all my medical records. I had to contact my old doctors to get medical records. So it takes time. So what I'm telling you is, don't cancel your insurance back in the States until you get your full coverage letter in hand confirmed in Portugal. And I say that because having coverage and medical insurance is not the same as travel insurance that you buy when you're applying for your visa. It is really important to know the difference, and you're going to be paying for two insurances at one point when you're applying for the D7 visa. Just chop it up as a loss, because that's a temporary loss versus you potentially having to not have, have that grace period, or not having your pre-existing conditions covered. So that's just something to think about. Yeah.
In the 2-month grace period too, it's very, very important. You don't sign up one day and you have your insurance the next day. I had to wait 2 months before it officially kicked in. So definitely keep that in mind before you cancel your stateside insurance. And then come to Portugal thinking you could just go to a doctor the next day and have that coverage.
Yeah. So, and we got travel medical insurance that we have now. That was a 6-month policy. Plus we're covered in the United States, y'all. And then next week we'll have private insurance. And so it's, there's that overlap. So when you're planning to move abroad and you're coming up with this budget, just know, there's some extra costs that are going to be involved, but in the long run, it's going to be cheaper. So Anita, for the most part, no, you can't. You cannot use Medicare here in Portugal. I mean, I'm sure if you're traveling and there's some emergency or something like that.
I was wondering if there was an emergency, you might get a one-off.
But that's why you buy travel health insurance.
That's why you have travel insurance.
Not just travel insurance where they cover your bags and stuff.
And there's a 90-day limit on most of them. So if you are abroad for 100 days and you try to go use that, they're going to ask you for tickets and things like that to prove how long you've been abroad. And so that's the other thing. People who try to get by saying, "Oh, I'm just going to use my travel insurance to cover me in an emergency," it doesn't last more than 90 days for most companies. So that's another thing. There's so much time.
Heather,
I will say that I remember I was in Clubhouse one day and there was a woman talking about travel insurance, and she had mentioned that people that have pre-existing medical conditions cannot get travel insurance. I want to say that is not true.
Not true.
It's called Geo Blue that I went with when I was in Mexico, and I ended up having to use them because I had an ATV accident, and they took care of everything: the communication with the hospital, the doctor visit, the medication, the x-rays, everything. So there's other ones out there, but from my experience, I do like Geo Blue, and I do recommend if you have a pre-existing medical condition and you need travel insurance, definitely look into them. I feel like their rates are very affordable, and their communication and my whole experience was very, very good with them.
And I recommend Swiss Care. So that's Swiss Care. If you are 50 or 55 and older, Swiss Care is really good. We had to actually use them, and they had no problem at all.
That's good.
So that's another great company.
Well, we've paid for a lot of travel health insurance, and thankfully haven't had to use any of it.
Yeah.
Okay. Okay, so Pollyanna Sunshine, do you think you would have had that kind of good care back in the States?
No,
No.
no.
I can
Um,
affirmatively say no.
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 I've actually, because I also have almost the same type of insurance that my niece, if y'all don't know, Heather has, and I've had a double mastectomy. That means they've taken both of my breasts off. First, I had a lumpectomy, and no, um, I thank God the doctors were able to do what they needed to do, but then they had to go back and redo the surgeries several times. I've had all of my lymph nodes removed on one side, and I'm gonna tell you, the care, the doctors were great, but the nurses, the aftercare was horrible. One doctor did screw up, and I got over here. One of the things that they did say was wrong in the US, the doctors over here said it was not wrong, it was actually right. And then something they said was right, it was wrong. But I can say one thing. One of my doctors in the US actually flew over here, made a visit to see me. My oncologist flew here. So that's something out of the ordinary that wouldn't happen.
Right, right.
And I thank God for him. But no, you won't get that care. I promise you.
And I've even had to deal with the emergency system because I have an underlying health condition called Chiari malformation, which causes me to faint sometimes, and pretty much, and you get vertigo and some other dizzy spells, things like that. And so in the U.S., when I had a fainting spell, that emergency ambulance, all that stuff, that cost me with insurance, I think 1,000 something. It was something ridiculous, and I was so upset about it because I got the bill way later, and I didn't even call the ambulance. Like a total stranger called them. I didn't have any say so in
Hmm.
the ambulance. So, I mean, I guess you get the consciousness, obviously, but by then the ambulance was already there. So for something, I'm just saying that to express that I had no say so in the ambulance coming, but I got charged, and it was less than a mile that they took me from
Yeah.
where I fainted and passed out to where the hospital was. Compared to here, I didn't go in the ambulance here, thank God, but I did have to go to the emergency, having dizzy spells and vertigo, and it was a completely different experience. Got an MRI that day, like no crazy wait, no. I was just, but mind you, this is a private healthcare system, so
Yes, Joe.
talking to people here, they have expressed that with the public healthcare system, going to emergency is a different experience. So I think it's important to get multiple perspectives and not just to over glamorize it, but private has been a very good experience.
Yeah, we were told that public, if you're going to get private, that the public system kind of acts as a backup.
Yeah.
And so, I agree with Beverly. I wouldn't want to take resources away from folks who have to depend on the public system because financially they don't have a choice.
Yeah.
I don't want to be a colonizer and come over here gentrifying and stuff. And so, Valerina, we kind of already answered your questions, but if there was a follow-up question or some twist that we did not answer with the pre-existing conditions, let us know. Hey, Howard Worldview, good to see you in the chat. So Pollyanna asked, do they all live in Lisbon?
No,
Oh, I live in Lisbon, yeah.
no.
Yes, Shar and I live in Lisbon, but Beverly does not.
No, I
She
don't.
lives on the southern
I need the water.
And
No.
would you like to say where you live?
I live somewhere near the water.
Not in
Um,
Lisbon.
not
Far,
in Lisbon, far from Lisbon.
yes, far
I
from.
can't. Yeah, I can't live in Lisbon. I'm sorry. I can go to Lisbon, but no. I
Yes.
love you guys.
So about in the car, about how far of a drive is that? Is that like an
Um,
hour?
it used to be an hour. Now it's an hour and 15 minutes.
Okay. Because
Yeah,
of the
in the
traffic?
car. We don't see traffic.
Okay. And well, you do
Yeah.
once you reach the city. I know that.
Well, Heather can contest to the way that somebody drives.
I mean, we make it they're safe every time. That's fun.
Yeah, somebody drives fast, but yeah, I don't live in Lisbon. But I do want to answer someone's question that came up. Can I please? It's
Oh
about
yeah, definitely.
dentistry and also about the equipment that is used. Portugal is not prehistoric. I just want to say that. So they actually have better equipment here than they do in the US. So I just want to let you all know they are pretty advanced here. Um, so you don't have to worry about that. I will let you know. Um, dentist. I used the dentist. Matter of fact, I had a root canal done in the U.S. and I want to let you know. Matter of fact, several people have had root canals done in the U.S. and they have to get them modified
Yeah.
here.
Yeah.
My son had his braces done in the U.S. and he did come over here and he had his braces removed here. Removed, clean. It was only 50 euros. At that time, the dollar was a little less, so it came out to $67.50. So that should answer your question.
Hmm.
And I used to pay a couple of $100 just for a cleaning if I were not insured.
So, and
Yeah.
my son wasn't insured here at all, so I'll let you all know. And plastic surgery, I have not had any plastic surgery here. I know some people are getting plastic surgery here, and I've heard because I'm in several different groups, and they love it. And a lot of people can go to Turkey and get their plastic surgery done, into Malta,
Hmm.
and they love it. Matter of fact, someone's in Morocco right now getting their plastic surgery done. But
Is this
yeah,
all elective plastic surgery or is this?
yeah. So yeah,
Hmm.
Yeah,
yeah.
and
Someone,
I
yeah. I
have
do live in Portugal. So someone wants to know, do I live in Portugal? I live in Portugal. I live in Portugal because I can't afford to live in the U.S.
and I haven't been to I go to London pretty often. The last dental clinic I had was when I was on a trip to London, and it was under £50, but that's with like no, and I obviously don't live there. I just wanted I went back to an old doctor from when I used to live there. I mean, dentist when I used to live there. It was under 50 for a proper cleaning.
And that's with no insurance, of course, because you
No
didn't live
insurance.
there.
I literally just went because like it's the doctor. I used to live in London. It's the doctor dentist. I used to say doctor dentist that I went to, so I trust them. Yeah.
Yeah.
Also,
Um,
there was I'm sorry, there was a question that was way far up, but I also think this is a very important one because someone had asked, is it easy to access specialty care? Is there like a long wait? But I feel like that's really important because in the States, you have to go to a primary care doctor. They have to refer you out. If they're taking people, there's like
Yes.
a long wait list. I will tell you, all I do is go on my little app on my phone, click
Yeah.
whatever care that I need,
Yeah.
make the appointment. It could be tomorrow. Done.
Yeah.
That's it. So
Yeah.
much easier. And there's not any crazy wait times. There's not anything that's out of the blue. You might have to wait a week or so if the doctor's not available, but there's always multiple doctors. They'll list if they speak English or any other languages, and you just don't have one option. There's several different hospitals that you have access to see specialty care. And I feel like it's not anything for me, it has not been any more expensive than seeing a regular doctor.
Yeah, I
yeah.
can echo those sentiments. Specialty care for the Chiari malformation because I have to sometimes do a video, audio test, and all the other stuff. It's been pretty seamless. I use Kuftejo and I have an app. So the app is really nice because I can find and do my appointments, find doctors. All my exams show up there. All of my results show up there. It's actually quite advanced. I actually didn't have this access in the States through the app. And I really like that everything
Yeah.
is conveniently located, including all my invoices. So, and again, because I have the thing, I may pay €2 because it's a coverage fee for like just like I think it's a COVID fee for they
Yeah.
so, but it's the app is great. I love it. It makes my life really easy. I can even check in when I get to the hospital on my phone.
See,
Yes.
see.
Yeah.
I think they're kind of getting that in the States now.
Yeah.
But I don't
I have
know.
apps from my doctor.
Do you? Okay. I mean, I know we can go online, but I don't know about an app. So checking on the kids, baby. So she's asking, or he's asking, what type of healthcare is available for veterans. So this is Portugal. So are you a Portuguese vet or a United States veteran?
They're probably a United
United
States
States
vet.
veteran, right?
And once again, you can use, for instance, CUF Hospital has, they are partnered to use your VA, but you have to pay up front and
Yeah.
then you will be reimbursed. So be
Mhm.
careful because we do know a veteran, and that veteran had 3 surgeries so far here, and they have paid thousands of dollars up front. So if you have a bank account with thousands and thousands of dollars, you have to pay that. And as a veteran, the government is very slow to reimburse you. So be prepared. And if you have kids that go to private schools, the private schools, you will have to pay their tuition. You have to pay your house. And if you get a car, your car note and everything else, you'll be waiting on your money. So just get you some private insurance
Yeah.
Yeah.
and, you know, then use that because your private insurance, you can pay it yearly and you can pay it quarterly and you have a peace of mind.
Yeah.
You know?
Also, to add to that, just be very mindful depending if you're using TRICARE for Life / TRICARE
Mhm.
Overseas,
Mhm.
or you're using the VA system, whichever you're eligible for. Some people are not eligible for both unless you're retired or medically retired. You're eligible for both, but TRICARE for the VA will only cover anything that's service connected. So if you go
Right.
to the doctor because your jaw is broken and it's not listed in your medical record that you have this, the condition, they will not pay for it. Just to give you a heads up. TRICARE, however, will pay for it up to a certain percentage. So just keep that in mind if you are going to the doctor. Make sure you, like Shar said, keep a file of everything. You can file up to, I believe one is up to 1 year. I think the VA is up to 1 year. You have to file your claims. TRICARE Overseas or TRICARE for Life, you have up to 3 years from the date that you actually went to the doctor to submit your claims. But the time is slow. I will say I did have to file claims in Mexico, but I actually had a third party do it for me. So I never had to physically do it myself. And I will say it did take 2 or 3 months, and then I would just get random money, in my bank account from TRICARE from being from being reimbursed. So just be mindful and definitely, like we said, get the Portuguese health insurance. It's so affordable, ridiculously affordable compared to the U.S.
So basically, do not plan your budget around getting reimbursed in a timely manner.
Yeah.
Have your extra money over here if that's the way you're gonna operate within the system. That's what it sounds like to me. So
Yeah.
Auntie Trey asks,
Does anybody know if hospice, or what is that?
palliative care?
Palliative care, letters are too small, would be covered under the public health care in Portugal?
Hmm.
And so I look at hospice the same way I kind of look at long-term
Long-term.
care. And so I think that is probably insurance dependent. And if you get the Cadillac insurance, private
Mhm.
insurance, which is the same cost that I saw at our age
Mhm.
of mid-level ACA, where you've got a $8,000 deductible.
Yeah.
So, but I think Auntie Trey, if none of our ladies can answer that, Michael from Serenity will be able to answer
Great
that
answer.
on Saturday.
Mhm.
Yeah.
And I purposely scheduled him after these ladies, so any residual questions about the system at large, y'all could ask him if you are of the African diaspora and want to join our Fire Over 50 group.
Yeah. And Serenity is a great company, believe it or not. And the way I discovered Serenity, I was talking to someone in another inclusive group, and they brought up Serenity. And then I was speaking to some other people, and they had never heard of it. And I was like, well, you know what? I like to dip my toes where others don't know about. And I said, okay, let's find
Yeah.
out about Serenity. And when
Yeah.
I did it, I was like, thank you, Jesus.
Yeah.
So
Serenity.
how would you describe them?
Hank Mad. If anyone heard of the show Hank Mad Concierge Service, it was a show a couple of years ago. Hank Mad was a doctor that went to these houses in inclusive areas, all these millionaire houses. And Hank Mad staff, he's a staff of nurses and nurses assistants and doctors. They come out to you, they come out to your homes, they do your blood work. You can call them at 3 o'clock in the morning, 12 o'clock in the afternoon, and they're there. They're great.
Yeah.
I have baby vein, and I am so freaked out because on my right side, um, I can't give any blood because of all of my lymph nodes. On my left side, my veins are all collapsed. So mostly they have to go in my neck or in my feet to draw my blood. Um, I know, don't, but it's okay. And these guys were like, first stick, they were able to get blood out. And I was like, I'm gonna stay with you all. And no problem. These guys were so good. Yes, they have gloves on. Yes, they're very neat. Um, they were able to just do things that it just, I was good. I was happy with them. I
So
can't even explain anything else. I needed to go to take care of some tests. My doctor was getting ready to go get married because we go to a place called December, which is by the water again. I couldn't get in touch with her. They came out to take care of some other things. They're great.
Yeah.
yeah. Yeah. And to add to that, when we first sat down to meet them,
Mm-hmm.
everyone came out. They
Mm-hmm.
all stopped what they were doing and
Mm-hmm.
they all came out and we sat down in a little courtyard and they all sat there and answered any questions we had. Say, you can choose who you want to work with, the registered nurses and I mean, everybody is fantastic. They made you feel so like you have known them forever and they
Yep.
were there to take care of you.
Yeah,
Yeah. Yeah.
definitely.
Mm.
Linda baby, I don't know what just Q is. So if I'm gonna keep scrolling down, maybe we've already oh, there it is. What about dental insurance? Go ahead, Bev.
Dental insurance is covered under your insurance. So you have dental insurance, you have your eye exam insurance. Once you get your insurance package, it's all covered under one. So they don't say you got to take, you have to pay for dental, you have to pay for eye. When you pay for your insurance, everything is covered under
Yeah,
it.
same.
And
Oh,
I love it. Yeah, I did notice that. Okay, Auntie Trey. I'm sorry, y'all. I'm trying to look and find all of these questions here. What was the name of Shar's insurance
Oh,
company?
it's ALLIANZ.
Yeah, we would probably pronounce it. It's Allianz, but Alliance. I don't know.
Oh, it's probably, so I'm actually probably pronouncing it wrong. I do that all the time. Y'all do not mind me.
Honey, it just depends on who's pronouncing it.
No,
The folks at Serenity said Allianz.
it's a
Allianz.
joke because I'm always mispronouncing words, so don't mind me.
And we just took our first Portuguese lesson this week, y'all.
Oh man, yeah.
Oh, great! Congrats!
I'm
Congrats!
So we have our second Portuguese lesson on Tuesday. When we get into the nitty gritty, I don't know. I'm just already like, oh my gosh. Oh my gosh. So, okay. And what insurance does Bev have? So yeah, she's with Allianz as well, right? Or no?
no,
Okay.
I can't even pronounce my insurance. I have to get the card for y'all. I'll send it to you. You can send it to them.
Okay, so
Yeah, but
so what we'll do if you're watching from the future, hey, say hello in the comments and let us know where you're logging in from. We
Yeah.
will put that in the description after
thank you.
after this.
Thank you.
So,
And also to add about the insurance, you can get insurance through your bank, which is pretty common here.
Yeah,
Um,
very
so I know a lot of people in our community do go through their banks. Each bank has a different insurance, and just definitely check your options depending on which bank it is. But also there are options like what Shar has, Alliance.
Alliance.
sounds
Sounds
good to me.
That's shade throw right there.
It sounds good, right? There's so many different options out there. And what's great about this community that's here is that we all have different ones. So it's good to, have firsthand see what other people's experience are with these different insurances, which will help you navigate and narrow down where you want to move as far as picking an insurance provider that will work best for your situation.
Yeah,
Yeah,
definitely.
and I actually initially had insurance through my bank, and I had a bad experience with them, and so that's when I switched over to Allianz. Alliance, whatever. I know what I'm talking about. Yeah, I had to switch over. And the bad experience that I had was that even though I had shown them all of the coverage and everything, they tried to say that they were not that they didn't. They were supposed to exempt me from the grace period because obviously I showed the continuation of coverage, meaning that I was doing a transfer policy, not a brand new one. Never had a lapse, and instead they registered me as brand new, as if I never had coverage, and that put this grace period into effect, and meaning they would not cover one of my emergency visits from a vertigo episode. So I didn't go forward with them anymore because they weren't being honest about what they were supposed to do.
Yeah, you have to be careful, especially if you have pre-existing conditions.
Yeah, and I showed all the paperwork. Like I don't hide it because I know
Yeah.
that those fainting episodes can happen whenever, and I don't want to be
Right.
not covered. So yeah,
Mhm.
like I showed them everything. So I don't know why they registered me correctly, and it was
Yeah.
stressful. That's one thing I'll say. Trying to navigate because I don't speak the language. When you need help with something for your insurance. Now, when I go to the doctor, because I go to a hospital that has quite a big staff. I mean, like Tejo is huge. I can normally find someone who speaks English if I have help trouble. And my doctor speaks English as well. Doctors that I go to, the nurse is not always. But when you're calling the health insurance companies, everything, all the prompts are in Portuguese. Which again, I live here. I should know Portuguese. I'm just not fluent yet, and so I struggled a lot. This is where having community and friends come into play because I struggled a lot trying to resolve that issue on my own.
Yeah, which is one of the reasons why we went with Serenity so that they could do that for us.
Yeah.
Because we've got pre-existing. So I know we answered this a long wait for specialty medical services. Did anyone want to add anything to that?
Yeah. No, just use your app and make an appointment, at least for COOF hospital. The app is in English, and you can just pick whichever specialty care. There's so many different options for specialty care, even some I've never even heard of. And you just pick one, and you just scroll through the countless amount of providers, and you make an appointment all through your app. You do everything through the app, unless you want to go in person and they can do it for you. But the app is very user friendly. I will say that the types of specialists are in Portuguese. However, they do look very American sounding names. So if you can just put two and two together, or use Google to translate, or just figure out what you're trying to translate for something specific, then you can find it. So definitely no specialty care wait at all that I have experienced at all.
Yeah, and I know when Rick was having some thyroid issues in the United States, they were talking about, he was losing we were losing about 3 pounds every day. So like 15 pounds a week. It was crazy. And they were talking about, so in 4 weeks, I think we have an opening and blah, blah, blah. And so folks, it's not like the United States does not have waits, because they do. We had to get our primary care person first to, make that suggestion or put the referral in, and then. So it was a long, arduous process.
And it's scary too, because thyroidism runs very heavily in my family. My mom, my grandmother, my aunts, my mom actually had to get hers cut out. Both my family have had hyper and hypothyroidism, and it's scary, especially when you're losing weight at a high pace, a high rate, and you have all these other issues that are happening. They're just like, oh, 48 weight, here's some medicine, hope you make it. It's like, what are your options? I know some people travel to different states, they're like really like they want to live. And I feel like in America, it makes it really hard for people that have medical conditions to live longer because either medical staff are understaffed or the intake is very hard. I remember when I was living in Florida and I think Hurricane Michael hit. So all the people from Panama City were coming into Destin, Navarre, Pensacola, and there were no doctors available at all. Like they were like, oh, 4 to 6 month wait. And I'm just like, what am I supposed to do? It's really scary. So that's another plus about Portugal or just healthcare outside of the US.
Yeah. And it's probably worse now post-pandemic.
Yeah.
Post-pandemic. We're still in it. And I was reading in the Portuguese news that the rates were going up again. So yeah. What's to say? I've always had medical coverage, and yet my parents always avoided taking me and my siblings to the doctor, and I have repeated the cycle with my son. It's a sad and totally ridiculous, right, Shauna? Same here. That's the way I grew up, and it really wasn't expensive. I'm old enough that it really wasn't that expensive back in the 70s when I was a little kid, but in the 90s on up. Even if you had insurance, there were just so many unknowns and you never knew what the final price was going to be. There was no transparency. There is no transparency. And so you think you're covered, but they're only going to cover, a certain percentage, but you never can get a straight answer out of these people for the total price. It drives me up the friggin' wall. I swear. Anyway, all right.
Enough for your credit report too.
Yes.
That right there. Okay, I'm going to be totally transparent. This is before Rick. When I was a single mom, I used to give them my wrong social security number because I knew that whatever the bill was going to be when I'd have to rush my son to the hospital, I wasn't going to be able to afford to pay that whole thing right off. And I was just going to make some payments until it was paid off. Some good faith payments. So I used to give the wrong social security number because it's ridiculous. I shouldn't have to go bankrupt to take care of my son.
Mm-hmm. Just the basic need for medical care.
Someone touched on this mental health and therapy session, therapy service. This touches home for me because something I didn't say. I suffer from anxiety and depression, and mental health and therapy service is available here. So you will have no problem with getting help. You'll go to your internal medicine doctor, and they will get you the help here easily. That is also a specialty service here. And I will let you know that unlike the US, where you cannot it is a long wait to get to a therapist. It is here. If you don't go through Serenity, I hate to keep saying Serenity. You can go to the hospitals here. And the hospital I use is Suda, and the insurance I have is Suda. It is the third hospital that is here. It's a smaller hospital, and a lot of the doctors are private doctors that have bought into the hospital here.
Okay.
So, you can get mental health here.
I love it. And obviously find someone who can speak English.
Yeah.
And so Michelle, the insurance that I said we were getting, it comes with orthodontia. I'm assuming that's what you mean by cosmetic. It does come with orthodontia.
Yeah.
Did you guys want to add anything to that?
Yeah, for the mental health, when I was in the States, I used an app called Doctor on Demand, and that's how I saw my, I like to travel for work. So it was hard for me to see someone in person. So for people who aren't able to see someone in person and who are open to seeing a therapist virtually, I do recommend the app. And when I came over here, I wasn't willing to let go of my therapist because she's so good. And so as a result, like I pay out of pocket and then have to submit for reimbursement.
Oh, okay. And do you submit it here?
Yeah, because my insurance covers me. It's like even outside of the States.
Which is good.
Okay.
Okay. I love it. So Ron asks,
What is the name of the travel insurance that Heather mentioned?
It's called Geo Blue.
that's right. That's right. Because Ron's about to go down to South America. I'm telling his business.
Oh, okay.
He's got this
Ron.
big trip planned in South America. Wish we could go, but
Then he's coming to Portugal to visit his best buddy.
that's right.
I'll be looking forward to meeting you, Ron.
Oh, you will meet him.
That's right. He is a traveler.
Oh, yeah. Big time traveler.
Yes. Okay. So where was I? Let's see. Can someone speak about?
Yes, they have Black doctors. What do you say, Black doctors? Heather can tell you and Shar can tell you what Black doctors. They don't use a box here for Black or white. Let me tell you, once you come to Portugal, and after you get your residence card, you're Portuguese, baby. You're not Black, white, Hispanic, Mexican, Asian. You're Portuguese. You can forget about the block anymore. You don't have to check that block. You're done. Only in America you check the block.
Yeah, so
yeah.
to add to Black doctors, we do have a wonderful Black doctor in our community. And I remember a conversation came up, we wanted to find Black doctors because, in the US, it's kind of like we're traumatized in a sense where as Black women, as Black men, we're not given that same equality when it comes to good quality medical care. So I remember asking, I don't know if I asked or someone in the community asked, can she recommend Black doctors for mental health, OBGYN, gynecology, like all this? And she mentioned that it's really not a thing here. It's not something that you can request. You want a Black doctor. And I will say that the Portuguese are very, very, very big on not using the Black term to identify with anyone. As you know, you guys both know from previous conversations of a video I made, and it's just not something that's here. And although I think the local Portuguese may not understand why Americans are looking for a certain set of doctors, not taking away that there aren't any great Portuguese doctors out there. I'm pretty sure there's plenty of them, but it's just someone we feel safe with, doing our care and everything. I have not seen any Black doctors. In the app, you can't shift through who's Black, who's white, or anything like that. You could just shift through what language that they speak. But outside of that, there are Black doctors here that are local Portuguese people or from one of the previous Portuguese colonies. But I have not seen a Black doctor at all yet.
Yeah, I also have not. None of my doctors and none of my nurses have been Black appearing. Okay, maybe you know what I mean sometimes. So I'm not sure because it was actually an observation that I had the other day when I was at the doctor's office. I was like, man, the other Black people that I see that work here, most of them were like support staff. So that did make me feel uncomfortable because it made me think to the point like there may be Black doctors, but I am not seeing them, and I have not seen like when I say like as a patient, I have not seen a Black doctor. Yeah.
Yeah. So I'm sure there are some, and however, we as folks from America who have melanin are, we're traumatized. Like the States will traumatize you. And so for anyone who's Portuguese who is watching, just understand that you don't understand. Until you walk in our shoes, you just cannot understand. So can someone speak to prescription drug costs, such as high blood pressure, diabetic meds, or?
Yes. My husband takes high blood pressure medicine, and his prescription is €7.80 right now, $7.80 for a 3-month supply. That's it. And that is no insurance, $7.80. And he was taking insulin, and a 1 month supply of insulin was $3.80. But he's off of insulin now. So that's the cost.
I also want to add to that. Another thing that I don't think a lot of people do know is that when you get your residency here, you get a healthcare number.
Yeah.
I remember I was at a doctor's office, private at COOF, and it was for my eye exam. He said, "You have an SNS, which is a healthcare number that you get." And I'm like, "Yes." He said, "Well, I'm going to input these prescriptions under your healthcare number so you can get them extremely cheap or free. Because if I don't do that, then you would have to pay, it probably would have been a couple dollars or a couple euros out of pocket. But these are some of the things like benefits. I think these are perks that, they're not written down for you. Like, hey, this is what you can get. Luckily the doctor was really nice and he told me about this. So now, I have future appointments. I'm always requesting, hey, can I use my SNS for this? Because technically I'm a resident here and I'm entitled to these benefits. I'm not saying that I can't afford to pay 6 or 7 euros at all. That's not to say that. But if I am eligible to receive something at a discount that's not taking away from anyone else, then why not? Especially if you have to keep getting these prescriptions monthly or every 6 months, or it's a reoccurring, because that adds up. It adds up really fast, especially if you take 5, 6, 7 different medications at a time, or you're switching. It's so many different factors. So just keep that in mind if you're watching and you do live in Portugal or thinking about moving to Portugal. Everyone is entitled to their healthcare number, and one of the benefits is getting discount prescriptions as well. Not for all of them, but for some of them.
So
Yeah, the
when
only prescription drugs I had to take was for iron. Before you get a fibroid removal surgery, your iron levels have to be a certain amount, or they can't do surgery. And so, for a couple of months, I was on it was for iron. It was whatever, and it wasn't expensive at all. So much so that I don't remember the cost because it was trivial. And then after surgery, they didn't put me on hard narcotics. They literally put me on kind of what I call over the counter type. That's the other thing too. So another thing I didn't know, in the States, you will normally get put on hard narcotics after a surgery. But what that actually does to your body, from what I understand, from what the doctors explained, is it slows down the recovery. And so you may not feel pain, but you may take longer to recover. So that's something
Right.
and so they do regular.
Yeah.
This is the crazy part. I'm learning all these things over here, and this was never shared with me in the States, even with me going to doctors who look like me, just thinking they have my best interest at heart. But that's probably the best that they were educated about, right? And so, not to a fault to them, it's education of the doctors as well over there may not be as high quality as we think it is. And so, I say all that to say, the drugs I had to take after, they were regular over the counter type, not hard narcotics. And they were also I think my mom went to go get them for me, and like she came back, she was shocked that I only gave her like 20 euros. So I'm just saying that this, it's quite a few things. So just let you all know, you will. I know there's some things you need to get used to here, and there may be a lack of trust that you're going to get quality care. But I think that is a myth. Not saying it's never true, but from my experience, people that I've spoken with, who have had to use here, quality has been found, and the doctors have been educated, knowledgeable, and even more knowledgeable than they would have been in the States for me personally. So,
Yeah. When I was here in June, I had to get hormone replacement therapy. I ran out. My insurance company in the States would not give me extra, even though they knew I was traveling. And so if I wanted to pay for it out of pocket, it was going to be $189 for 1 month. So I came here on a hope and a prayer, went to the pharmacist, showed her my prescription. And y'all know, if you saw the other video that we did months ago, that I paid €8.30 with no insurance. and obviously not even a resident because I was just visiting at that point. And so, yeah, I think we answered the question about plastic surgery. Let me go back.
Yeah.
Information. Encounter issues due to race when receiving care.
No, I didn't. I haven't.
No, but there was
I
one.
have.
Oh,
Oh no.
go ahead.
Go ahead, Shar.
No, I was saying I had one nurse in my aftercare from surgery who was hella aggressive with me unnecessarily. And so I just asked for him not to come back to the room. Again, that could have just been his normal bedside manner, but he was the only male nurse that I had, and he was just a bit like when I say aggressive, I was getting my blood transfusion and he's like tapping the bag and like trying to speed it up. What are you rushing this for? I can't leave anyway, you know? And I just felt like he was hella aggressive for no reason. So I expressed my lack. But the thing is, I fluently enough needs to explain to him to chill out. So when the next nurse came in, who had been very kind to me, I just told her what happened, and then I didn't see him again. But I wasn't trying to get him in trouble. I just told her like I'm not comfortable, and I told her explained her exactly what happened, and she said, "Oh, he's just in a rushing because he wants to leave." And I was like, "Well, you know what I mean?" So
He got a dinner date.
I don't think it's a race thing. I think my man's trying to get home. So it's probably family weekend. So
Yeah, I don't think, here the work ethic, if I don't want to call it a work ethic, the work habits are different. And
way different. Way different.
Yeah.
Way different.
you need patience.
Very.
You need for patience in Portugal.
Lots
So
of
what was
patience.
Heather?
Yeah, I think Heather was saying that she hadn't run into something. Or go ahead, Heather.
I hadn't run into anything, but I know Shar mentioned about bedside manners. I think Europe is different. It's way different than the US. I will say I went in for a specialty exam. And normally, you go in to the doctor. They're like, hey, put on a robe. When you're ready, just lay down and the doctor will come in. That's not really what happened. The doctor was just there at his desk. The bed, you're supposed to lay on. Those like old school pull out. It's not a curtain, but my sister had one. I forget what the proper name for them. And they're just like, yeah, just get undressed and lay down. And I'm just like, I don't get a robe. He had to do an exam on my chest, and it kind of took me back because I'm just like, but this is not. It didn't seem right because in the U.S. they give you like your privacy, but here it was just like, okay, just lay down. We'll do the exam, and then after the exam was over, the desk is right there. He just went back to his desk. He was like, you can get dressed. So I literally had to ask for something to close myself. And I guess for them, they were just like, but why? Like in the lady's face, it was very like she was confused and I was confused too. But I think it's just that's common practice here where it's normal for your doctor to be there for you to get undressed and everything. And I had another exam in another room and it was kind of the same thing. And I'm just like, okay, maybe it's me. But I did ask, and one of the comments were that, we're very prude. Americans are very prude when it comes to, our bodies. But in Europe, nudity is like, it's nothing. It's not something that gets looked at or anything like, oh my God, why are they exposing themselves? Little kids run butt naked at the beach and it's just like, it's nothing, So it could be also one of those things, traumatic experiences that some people do have in the US where if a doctor is in there in the same room, you're getting undressed, are they doing something they shouldn't be doing? Are they looking? There's so many different scenarios that could run through people's mind, but I know that it did make me feel uncomfortable. And I'm not saying I'm going to be like, okay, whatever, you just need to get with the program, but definitely if you feel uncomfortable, definitely speak up and just say, hey, do you mind 5 minutes? Thankfully, that little curtain, whatever that thing is called, was there. And I just like walked behind it and put on the robe, which I actually put on backwards, by the way. I don't use those too often, but it's a little bit different here. But I will say, as far as the doctors I have seen, as far as their communication, has been pretty good for the most part. They have spoken enough English to, hold a conversation. And I feel like they were very good at pointing everything. Like if I had a question, they actually took the time to answer that question, which I feel like I would not have had in the States. With my pain management doctor, she was always in a bad mood. Like, I don't think she liked having patients. I think she was in the wrong profession. And it was like she either ignored you or was rude and left the assistant or the nurse's assistant, the second person that's in the room with you, a nurse tech, which I'm just going to call their title. And she would just be like, okay, hey, this is all, she would explain everything to me. But the doctor themselves, they're just really rude. Like, you're making this up, or they just did not want to be at work. So I will say I do appreciate that about Portugal, for being great communicators and being a little bit more understanding and a lot nicer than some of the doctors I have experienced in the United States.
I had this one gynecologist tell me, "Are you back? Oh, you females have so many health issues."
Oh my gosh. But you can ask for the complaint book. Don't forget about the complaint book.
Yes, that's a big thing. Yeah. Please
People
don't.
don't know about that, but ask for that complaint book, and everything in that book.
Yeah. With any feel, ask for that complaint book.
Mm-hmm.
I was young, so I didn't know. I was just kind of like, Chanda, we kind of did talk about insurance plans, but I think it depends. Like, there's not a one size fits all. We've mentioned Allianz, and there's a couple of other ones that I know of that I cannot pronounce. I will drop the ones that are known as respectable, full service in the description after this. But it still depends. There's no one size fits all.
Checking on the kids' story is a she.
Yes. So, okay. Thank you. Checking on the kids. You are a USA veteran and you are a she. Thank you. Thank you. Thank you. Winnie. Sorry, I'm late. Did anyone ask about wellness care and if fees for preventative care are less than curative? Oh, okay.
You mean like a gyno exam that you do every year for women?
Like pap smear and stuff like that.
Oh, yeah. I've done like at least 2 over here in 2 years. Yeah, I've done 2. No problem. I mean, it's covered. No issues. I don't notice a big difference in how they do their gyno, pap smears and wellness checks here versus the US. It's kind of all the same, obviously way cheaper in regards to cost. I do like a full pap smear and STD screening all the time just as a part of my normal checkup. And it's fine. It's the same process US for me.
I will say that my experience was definitely not the same as the US. This is with the private sector. I went with a friend and I was like, I'll get tested for some STDs to see, how the private insurance works. It was okay. Anything that's free, you need to get there early. I thought we got there early enough to a public hospital, and we had to take a number. There were probably 50 other people there that were probably there for different things. We waited for like 3 hours, and then you go into a room. This is for the STD screenings, and the lady's talking to you. She asks your name, verify your information. And she's just like, okay, here's a swab, here's a tube. Just go behind the little pull-out thing. This thing, I don't know what it's called.
The curtain.
It's not a. It's not. It's like the old, the old school.
Yeah, like the accordion type thing.
Yeah, what is that called? Older generation.
Gosh.
In their home.
Exam curtain.
Yeah. No, it's not the exam curtain. People have it in their homes. Older people have it in their homes.
Yeah, I know exactly.
We know what you're talking about.
Yes, okay, well that.
Like the wall panel things.
Yeah, it's like the wall panel, but it's
divider.
No, it's called something fancy.
He's about to Google it. He's about to Google it.
Google it. Like, you could go behind. I guess they would have it in brothels too. I think I've seen it in movies in brothels. But anyway, back to my story. Okay, so the lady gives me like this big cotton swab, and she's like, go behind there and partition. Yes, I knew Beyonce had a song about it. Yeah, okay. I was thinking Beyonce. I'm like, partition. Okay, but anyway, I had this
Heather, is this the public or private hospital?
This is the public.
Oh, okay.
Public hospital in Portugal or in the United States?
In Portugal.
Okay.
Shar said it was the same. Her situation was
private. That was private. I didn't go to public. It was private. Yeah.
No, I'm sorry. You went to private, and I'm.
He's talking about public now. I just want to make sure people know the difference because my experience, private, everything was the same as U.S. Yeah.
So public, like the same. A public hospital, which you are entitled to go to. So I went for STDs, and I don't have STDs. I just going
with a friend.
Let's fast forward past that part. Anyway, so I have this big cotton swab, right? So in the US, you have like a nice little bed, you have like the clamps, they like do the whole exam for you. I was a doctor that way. That day I was doctor, okay? I did the swab, I did everything, swabbing up in there, put it in the little tube, and I just gave it back to the lady. She was like, okay. And I thought it was odd that she actually had to leave the room. And everybody's PII, personal identified information, was just laying there on the desk. I was nosy. I'm not going to lie. Okay. Joanne. But she left and she came back. And I will say that was it was an experience that I was not expecting at all. I thought they were just going to, I was going to lay down, they're just going to do the exam, they're going to ask me questions about like how many partners I've had, if I have unprotected sex, the normal questions they do ask in the US, but it was not like that at all. So afterwards, they gave me a paper and they were like, okay, time to do your blood work. Okay, that was in another part of the hospital, which I believe was a morgue at some point in time. And that was another 3-hour wait in the line. And I will say the nurses there were very rough-handed. In that public hospital, I have a very thick vein on my arm, which is easily accessible. And I don't know what they were doing that day. They like jabbed me in there and everything. So
I'm glad you're sharing this because I would like.
It was a whole experience. I'm telling you, I was there. Shar, it was the day I ran into you. Me and my friend, we ran into you, and then we walked home. It was that day. We was at the hospital. That hospital.
That's why y'all look crazy. I was like, are y'all okay? If you would have told me that happened, I would have understood. I was like, are y'all okay?
You're like, are you okay? That was weird. Are you okay?
No, I was actually. I think like hours later, I text you like, hey, are you really okay?
Yeah.
Okay.
So I have to say that, first of all, that just sounds traumatic and crazy.
Yeah.
Mm-hmm. I have had to do my own COVID test. Right?
Yeah.
But that's the extent of it. Now, our Rich Journey, their daughter went into the hospital and had to access the public system. And thank God, their story was as one would hope. But maybe because that was it was a serious thing that she went from the private and they shipped her over to the public one for whatever reason with the machinery or whatever. And so I just want to say, put that out there that, I just want to put that out there.
Everyone's experience is different. But to fast forward, so they actually email you your results. In the States, they normally say, if we contact you, something is wrong. But if they don't contact you, nothing is wrong. So when I get this email, I'm just like, oh my God, like, how is this even possible? Like, I might as well be celibate at this point, but how? Why am I getting an email? So I get an email and it's just like, you're fine. You have nothing. Like, here's your results. Thank you. I appreciate that. But it's just, it's a different process. I highly recommend the private insurance where you could just go in, get it done and be out. Even blood work, I feel like it's pretty straightforward. You might have to take a number and wait like 20 minutes. But I highly, unless like you really don't have private insurance, for my experience, I would suggest don't go to the public health system for that, because I can only speak on that. If you have private insurance, definitely do that route. I did take one for the team, so you guys know I was literally there all day long, all day,
So
all night
that
long.
you
Lionel Richie, all night long.
Heather, my nickname for Heather is Shade Thrower. So yes, I read the comments. She is very funny. I
Oh,
mean, Heather will have you rolling it, even when I don't feel well. All I got to do is talk to her, and
oh,
she makes my day. She makes
and she
everyone's day.
and she
Even when
cheers Auntie up.
yes,
yeah,
even when she's not feeling well, just to let you all know, she hadn't been feeling well for the last couple of days,
yeah.
and this is how she is right now.
I
So
love it. I
yes,
love it.
everyone's saying that we all look good. It's because the weather here. It does something to you. We all have health issues, but you can't tell. As Shar says, she has something going on with her. Heather has something going on with her. The host and the hostess has something going on with them. I have something going on with me. But the weather here, the air is thinner. The people here, the anxiety level goes down. We
Down.
don't have
Yes.
time to think about what's happening with us because we have time to set back and breathe and to release. It's better energy here. We can think, we can actually, it's a Zen moment. The whole country is Zen. I'm just going to tell you, it is
I love
Zen.
it.
So it's for
Yes.
the healthcare, the people, the funniness, the shade thrower, the calmness. Shar is a very calm person. The host and the hostess, calm. The shade thrower is peace.
I love it. I have to give a shout out to Dr. Phil. We love you. As you all know, he gave us a super chat. All of our super chat and super thanks money goes into our scholarship fund. Y'all know that we are doing a Get Your Money Straight 1 week challenge right after Black Friday. So don't be spending all that money Black Friday and then have to get and then not have any money to get straight, right? It's a 1 week challenge. The information is down in the description. And tickets are going fast, so the early bird special is probably not going to last as long as we thought because it also comes with a one-on-one session with Rick and I. Ask us anything. So that's an $87 value right there. So we might have to move up that early bird price. So don't wait if you want to do it. If you need a scholarship, send us an email, hello@ourblackutopia.com. Small plug there. How does the health care for pregnant Black women in Portugal compare to the States? So yeah, we do have a higher mortality rate, much, much higher mortality rate in the United States. As a matter of fact, a Black woman with a terminal degree, that's a PhD, doctor, lawyer, has a higher chance of dying in childbirth than a high school dropout white woman in the United States. I saw someone in one of the communities who did have their baby here, but I don't know if you all know of any stories.
Yeah, Ty did. Ty had her baby.
Maybe that's what I'm thinking of.
Yeah, she already had.
And
Yeah.
and did she have anything negative to say?
I wish I could remember, and I believe Driven Spice did a medical talk with
Yes, she
Jamila,
did.
and it was one more person, Mrs. Karen. So I would check that video out as well because I'm sure there was a wealth of information.
Yeah,
Cinnamon has really information on her channel also. But I
yeah.
did look up the mortality rates because I was curious when I saw that question. From 2019, the deaths per 100,000 lives births. In the U.S., it was 17.4. In Portugal, it was 11.5. But that's not broken down by race. So, but I'm
Mm.
just saying, Portugal has less mortality, lower mortality rate per childbirth than the U.S. So that's just something to think about. One thing I want to point out, you all can just Google some of these numbers because I think a lot of times we've been conditioned and socialized a certain. We've been conditioned to think that it's better in the States, but just fact check it. You can literally Google some of these things and see for yourself.
Yeah, definitely. So the one part that Julie asked about the mental health thing, she said U.S. therapists and paying cash. So if all of that is covered, then we ain't coming out of pocket to pay cash unless
Yeah.
unless there's a copay, right?
No, I still pay cash, but I have to submit for reimbursement. But that's because I
Okay,
don't want to let go of my therapist because she's phenomenal.
that's right. That's right.
And I
Yes.
pay nothing. I pay
Okay,
zero. I have no copay.
I love it.
When you say ridiculously affordable, can you give us a ballpark?
So I think we answered that question,
Yeah.
but we can repeat it. For Rick and I, it's going to be somewhere in between $170 and $200 a month, or $2,000 or so a year.
Yeah, for
me,
me, for the best coverage, meaning zero deductible, zero copay, and that's important to note. It's €100 in a month, but you have to pay everything up front, and so that's you pay 1,200 for the year. But it's top notch to me. I have no. It's well worth. Yeah, checkups alone will it's fine.
Yep. Yep.
And since I just paid the bill for the whole year last week, the total amount exact was 2,542 euros and 33 cents a whole year
and
for
I
two
believe
people over 55, both were pre-existing.
I have the lowest amount out of everyone. So please don't jump on to my bank to sign up. So I pay 16 euros for two people a month, which comes to under $200. I'm sorry, 200 euros for the year for two people, for myself and my daughter. I do have pre-existing medical conditions, but also I do have 3 other insurances as well. My co-pays are $35, and now that I know that my blood work can be taken care of through the public health sector, I will be using that method. But if not, then I would just pay out of pocket for the ones that my insurance does not cover, and I will be reimbursed. And for those wanting to know what insurance I have, my bank is Montepeo, and my insurance is Lusitania Insurance. It's the one I pay 16 euros for.
And I don't have it through my bank. I actually have it through an insurance company. I don't,
Okay.
and also you can get insurance through the electric company, your water company, your your cable company, which is your phone company.
You can even get a bundle.
Yeah, but
You can get a
Every,
bundle.
everybody gives you insurance, all jokes aside. It's
Yeah.
funny, but they all give
yeah,
you insurance.
yeah,
So,
it's true.
you know,
But I would say people should be really careful to don't just look at your premium. Think about the copay and the
Yeah.
Yes.
deductible. If your
Yes.
deductible is something like $8,000 or whatever, you need to do the math. So please don't be fooled by just the premium. Think about your deductible and think about your copay as well.
Yeah.
And what it covers.
And what it
yeah,
covers, right?
yeah.
And yeah, and when the deductible kicks in, and when it's unnecessary. So Phyllis asked, how far back do you need to provide medical records for pre-existing conditions?
All the
Um,
way back to the
it's-
symptoms. The symptoms part.
yeah, and we'll have, this is a question also we should ask Michael on Saturday, because he did ask us just to prove that we'd have no gap in insurance. But I mean, I'm supposed to go back to I'm 24 years old and I'm 50 something now? No,
They
I think 10 years is probably sufficient, unless it's a reoccurring cancer or something like
I
that.
don't think he had made mention of it, and I think it was 2 years.
Did he say only 2 years?
I think it was 2 years.
Okay, so Saturday we will have an exact answer for you, at least with the companies that we're looking at. Well, no, you can ask him just in general.
And for
Also,
me,
oh, sorry.
and for me, they didn't even ask me to go back for anything. I just gave them the document I had printed up. I guess I had everything, so many files for them for the insurance company. I just had a document that stated from the VA that I had insurance already, and I guess they didn't even ask me because I asked them the question, what if you have pre-existing uh, problems? Can I get insurance? And I had the document already printed that I had insurance, and I had the insurance with Swiss Care. And she was like, "Oh, Swiss Care," and she picked up the phone and called. Well, she had pre-existing, she had cancer, and she said, "Does she have cancer right now? She have any symptoms?" She asked them on the telephone. Well, they asked her, and she was like, "Nope, she doesn't have any symptoms right now." She didn't even ask how long. And it's like, "Okay, you're approved, done."
So to add to this, I know the question was a good question, but it could go either way as far as whether it was regarding to insurance or when you go to a doctor, how far back do they want to see? I would say, like for my experience, I brought my last set of blood work, which I had done in Mexico, and all of my doctor's notes and anything I got from the doctor in Mexico, I brought back with me. I lived in Mexico before Portugal, just for some pretense. And she was like, okay, so I'll take this information. We'll get new blood work done for you. And she, they compared the blood works and they asked, what are your symptoms? What medication were you taking? So definitely, I believe, 10 years is really good, especially if you had a lot of different things happening throughout the years. But it's always good just to have like the last 6 months to a year ready, whether you have to put highlights in it or break it down based off of the specialty care that you're needing. But also just make sure you have that with you when you travel, or if you have an electronic version, or if you have access to it online, it's also something that's really important as well. Because some doctors will look at you, like for example, me, if I go to the doctor and tell the rheumatologist I have autoimmune issues, she's going to look at me like I have 7 heads because I look perfectly fine. I don't look sick. I have beautiful glowing skin, and they're going
Yes,
to
you
be like,
do.
yeah, thank you. They're going to be like, let's run a whole bunch of unnecessary tests on you versus, which is going to cost you more money in the long run versus if you say, hey, this is what I have. These are the tests that I have done. This is my blood work. Then they will base your assessment off of what you brought to them and what your, complaints are right now. So just keep that in mind as well.
Yeah, I know in my case, they did ask me to go back as far as when my symptoms started. And so my symptoms, I think, for my Chiari had started in 2019, whatever. And then for the fibroids, 2017. So I had to call because I didn't have everything like handy. I did have to contact my doctor. And then I also had to contact the insurance company, which is actually really stressful because the insurance my company that I had quit, like I was working corporate. And so it took some time. So I'm just saying, give yourself some time to get all your paperwork together and just make sure you don't have a lapse in coverage. Like if there's just one thing you can take away from this, like don't have a lapse in coverage. So whatever you got to do until you formally get your insurance here, just do that.
Yeah. And if if you live in a state that has the ACA, the whole version of ACA, then that might be less expensive than Cobra. So Grace and Opportunity, love your name. How is the care for people with disabilities or cognitive development delays kids into adulthood? Has anyone had to deal with that or heard anything? Okay. So Grace and Opportunity, this is a very, very specific question. And I would say if you are from the diaspora and you'd like to join our Facebook group, then this Saturday, we will have Michael from Serenity on who can probably address that question for you. I just had to put this up because I knew this and it's kind of interesting, funny, but hey, that's the public system as I understand in Mexico, where yes, you do have to bring your own sheets. And I think the family has to bring you food too. Am I remembering wrong? Do you know, Heather?
That experience, I was in the Yucatan in Merida, and I went to a private hospital. So I'm not familiar with the public system as far as staying at a public hospital, but I can believe that's probably a real thing. It's things are differently ran outside the US and other countries. So I cannot confirm or deny that is, but I know that was not my experience.
No, when I had my surgery, and I had a 4-day stay in the hospital afterwards, they cleaned those sheets every single day. Like I got fresh sheets put on my bed. My unit that I was in was very clean. They cleaned it every day. The food was better than the food I cooked, but I'm not the best cook. I thought I was actually very, like, my expectation was low, and I'm a germaphobe, so I was looking at everything, right? And I have a little bit of OCD, so, if I say something was clean, it was definitely clean. And the food was good as well. And I remember, like, I was kind of taking videos to show my mom because I think my family was slightly nervous also. My mom didn't come till like the day I got out. And so, like, when she came to the hospital, she was like, "Oh, it's really nice." I was like, "Yeah, it's been a great stay." Like, I had a really positive experience at the hospital, and it was very clean. But it's a new hospital and it's private. So, again, I try to give all the caveats because you may talk to someone else and give you a totally different experience.
Yeah, absolutely. Absolutely. Okay, we're going to start wrapping it up, guys. Does your Portugal private insurance cover you while you're traveling in the EU?
Yes, I have full
I would say
coverage here in the US. Yeah.
And Heather, you said?
Yes, I had a friend from France, and he had French people here. They own a business here, and one of them had to have their girlfriend go back or here to get something was going on with her. And I asked, was it covered here? He said yes, he's covered throughout, like, the EU as well. I thought that was very interesting because I thought that maybe it was just, he's from France, so it only worked in France. But he's like, no, he also has coverage here too. So it was very interesting to know that. So I believe it's universal as far as in the EU. But always check your insurance and your policy and what it says. Very important. Trust but verify, right? Just to make sure that you are covered. I know my Portuguese private insurance is not covered in the US, but mine is through my bank. Shar's is not through a bank. It's Allianz is a very well-known company for insurance. So it doesn't surprise me that it is covered in the US too.
Yeah, as a matter of fact, they have it in the US as well. So, and Bev, do you know if your health insurance here will cover you in the US? I know you've got the veterans insurance and all of that.
It will. Yeah.
Okay, that's great.
Every country in the world.
And I want you to know that we're not ignoring you, but we did address this. So thank you. About the Black doctors. And I'm just looking for some last minute questions, y'all, because we are going to wrap it up. I tried joining the Black in Portugal, and my application is still pending.
So, okay, so I am one of the co-founders for Black in Portugal, so I am one of the admins. I will have to sadly inform you that application has not been pending weeks, as we do weekly approvals on Thursdays. If you do not have a face on your Facebook, you are going to be denied. If you have not answered all of the questions, since it is a safe space, you will be denied. However, if you send me a message on my Instagram, or you can send me a message on my Facebook. If you look on the admins, you'll see Heather Proctor on there. I will get you in, but it's just because we want to keep it a safe space, So if people don't answer the questions, or we can't verify who you are, as a sense, if you're a real person, if you're a troll, if you're anyone from the diaspora, then you will automatically get denied. So just send me a message, and I would gladly get you accepted into this amazing community.
Yeah, it is an amazing community. The friends that we have, the reason why we found this apartment are a friend of a friend that we met through Black in Portugal and everything like that. So it is definitely amazing. And the same is true for Fire Over 50. Our Black Utopia is Fire Over 50. If you do not have a picture on there, and especially if you're not part of another group that I know does their due diligence, then you're going to get denied.
Yeah. And part of it is like people aren't trying to be snobby. We genuinely want to keep communities safe, and we because I run a community as well, and it's overwhelming sometimes because we deal with real trolls a lot. Like, I'm sure there were some trolls on during this live, and because the reality is not everyone's happy with people coming to their country, and not everyone's happy with Black people. Just being honest, they don't say it. Normally, that's what it is. And so it's hard for us to just accept everyone into the group, and if you don't pass the screening. I'm just saying that because I don't want people to think we're like trying to gatekeep. It's just actually the protection of keeping the space safe for us and everyone else.
Yeah, definitely. What are your opinions of doctors' bedside manner? So does anyone want to add to the bedside manner stories?
Quick, because the doctor, my gyno, that was recommended to me from someone else came with the caveat that like his bedside manner might not be the best, but he's really good. And she was spot on. I'm so glad she told me that because I would have been turned off from him. And it's funny, when I went for my checkup after surgery, my mom came with me because I was like, you just got to meet him. And I really like him a lot, but his bedside manner, like he was like, if you want to have babies, you need to have them now. Like he just talks so direct, you know? So when you get what I mean, like for some people that might be too much. And so when I say this just to say, like, if you need someone who's really soft or whatever, like maybe you may have challenges, but if you are, don't mind straight talk, then I think you'll be okay.
Yeah.
This is an interesting question. Has anyone noticed or heard of not needing to take as many prescriptions as you needed in the US as a result of a healthier lifestyle, or ended up not needing some of the meds? Well, one of the things, I think it's interesting is the lack of pain medication that is prescribed, and which we know there's an epidemic in the United States, and small towns are being wiped out because of pain meds.
For my Chiari malformation, they were trying to give me surgery where they like cut my skull and all this wild stuff that they're proposing in the US. Here, they were proposing medication, which I also didn't. I was like, I'll change my lifestyle. I don't want to get hooked on any medication. So one was like kind of extreme with like, whole surgery that the effectiveness rate of it is quite low. The other one was medication. So, I mean, you can take that as however you
From you go ahead, Heather.
Oh, okay. So I actually had an experience, with autoimmune issues. Like you have to take so much medication, and one medication can cause blindness, liver issues. You can get mad, all of these crazy things. But what I noticed when I moved to Mexico, when I was seeing my rheumatologist there, she was explaining, like, she's like, why are you taking all this medication? They're not actually treating the issue. They're just treating the symptom. And not combating the actual problem. So she took me off a whole bunch of medication. The only medication that she did not take me off, which was a pain medication, which it's weird because America prescribed it to me. I definitely needed it for sure, but it also is a pain medication, but it also, you can get addicted to it, but it also is for people that are drug addicts too. So I remember every time going to the pharmacy, they would always like look at me like I'm a drug addict. Like literally, they would put me aside and have a whole conversation. I go, I'm not a drug addict. Look, I come here every month. I'm just getting my pain medicine because I have these issues. So I noticed in Mexico, they stopped a lot of medication. They're like, we're actually going to treat what the problem is. And another thing that my doctor said, my rheumatologist said that, they're saying you have 6 different things, However, it does not make sense for you to have these 6 things. It makes sense for you to have maybe 3 or 4 and have the antibodies, for these other things. So it really made me open my eyes because I never heard of that before. They're just like, you have this, 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 and this. I never said, yes, for sure you did some blood work. However, you do have the antibody for it. So that was a major thing I noticed. And when coming to Portugal, I said the same thing, what the US was telling me, coking me up on drugs, filling my womb, and then going to Mexico and decreasing all these medications. And even now here, some of the medications are the same. I'm not taking as many. I am completely off pain medication, which has been a huge adjustment for me. I'm not going to lie. It can be a struggle every day not having pain medication, not because like my body is like addicted to or anything, but just the chronic pain that comes along with having autoimmune issues can be a bit rough. But just them not trying to shove it down your throat. I probably went through 15 or 16 different pain medications over a series of years before I found one that worked best for my body. But I noticed overseas, they don't want to give.
Uh-oh. Is she freezing for everyone else?
Yeah.
Sorry. Now. And I do appreciate that about them, that they're not pushing opioids on you. The doctors here want to see you get better genuinely, and they're actually listening to you instead of just saying, oh, this is this medication, and I'm like, well, I did my research already, and I'm in these support groups, and other people are taking this and has less, reaction or less, symptoms. And they're like, oh, yeah, I guess we can do that. And it's like, I'm not even the doctor, and I'm telling you all this. Like, you should be telling me as a patient. So, I will say that if you find a doctor that you really like, definitely keep them close to you. Definitely communication. I feel like I have not been afraid to speak up for myself, to advocate for myself for medications. I don't even know what the question is. My point is, yes, I find myself taking way less medications than I did in the US versus now. And I feel that health, I do feel better in a sense where I'm not drugged up and feel like groggy and like zombie like all day because the reactions from the drugs are making me so out of it where I'm just like out of who I really am.
And for me, I was taking almost 27 pills. Um, Something else. I do suffer from fibromyalgia. That's why I need to be close to the water. The water here is very cold, so me dipping in the water actually feels better on my body. And I do suffer from another thing is crystallemia malaria. Y'all can look that up. It is not a contagious disease. It is the disease that you get heat bumps all over your body, but they're blisters. I am allergic to the sun and I'm allergic to the humidity. Um, I am where I was living at, it was very humid and I break out really bad. My dermatologist used to tell me she's just taking my money in the US. And she kept telling me that you keep seeing me. Um, you're going to do is waste your money, but you need to move out of the US. You need to go to Greenland or to Finland.
Hmm.
Um, I thought she was joking at first, but when I used to get it, I was in the military, and I thought I was going crazy because the time I go to the doctor, there was no bumps on my body.
Hmm.
Um, After I got out of the military, um, I actually was in Japan, and something say take pictures, but then my phone broke, and I didn't have pictures anymore. So it was after I had my stroke something says, take the pictures. I went into the pharmacy and the pharmacist was like, I don't know what the heck's going on. So I went to an allergist. The allergist was like, well, you're allergic to all these things. But then the doctor said, go to the dermatologist. Dermatologist, like, I know what you have. He says, you're allergic to the sun. You're allergic to all of these things. We moved, came to Portugal. I had one breakout when I was living in December. It was sun, no problem. I moved to another place called Mafra. I broke out. Mafra is the wettest place.
Oh.
I was like, oh my God. So we took the plunge and we're in a home now with a yard. And I was doing a cookout and I was like, oh my God, I have these bumps on my skin. And I think Heather actually saw them as well. And I was like, Jesus, take the wheel. I can't deal with this. But then they go away. I take a cold shower, it goes away. Um, Here, my doctor here saw them as well, and they actually was able to help me to get rid of what I have. The doctor here also, there's a lot of medicine in the U.S. that they do not prescribe.
Mhm.
Um, they will not prescribe. Gabapentin is not prescribed here. It's illegal. So I'll let you know that.
But which
Um, Gabapentin.
no, they prescribed me something gabapentin at school. They prescribed me
They
gabapentin.
Oh, it used to be illegal, and actually, the doctor here, my doctor was like, nope, nope, no, 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 no. We'll give you something close to gabapentin, but gabapentin is not. It's
Huh.
legal.
Interesting.
And I was like, okay, there's a couple of medicines that the U.S. will give you that they won't give you. And I will tell you, there was another medication that I was taking in the U.S. as well, and it wasn't. It was like, nope, not on the list. We can't give you. They gave me something close to it, but it actually worked faster than the medicine in the U.S.
Wow.
Uh, I take Topamax, which is actually a seizure medicine, but I take it for headaches because I also have cluster headaches, cluster migraines, and it actually works better than the U.S. brand. So a lot of ingredients that the U.S. allow you to have or put into the foods and the medicine, they don't put in here.
Yeah.
But I'm gonna talk to my doctor about that.
That's interesting that you should say that because one of our other subscribers asked about the food here as well. And yeah, so there is such a like an FDA type of department or agency here. And even on the processed food, they'll have a scale A, B, C, D, E maybe, saying how healthy it is. There's, they're on. It's against the law to put so much salt in
Oh
Yeah.
certain
yeah,
foods and things like that. So as far as sickle cell goes, I do have a trait. I'm not sure if any of you ladies have sickle cell or have had experience. Shar, go ahead. Was somebody going to say something? Okay, this may be something that we should ask Michael. I do have a trait. There, however, because it is a disease that started in Africa as a defense against malaria, it would not be surprising if they are familiar with it because there are a lot of Black folks here or folks from the African diaspora here. And so I'm sure it's not just American Black folks that have sickle cell.
Yeah.
And do any of you have female doctors?
yes.
I do. Yes.
No, my guy knows a guy, but he's really good, so I'm comfortable with him.
And actually, the doctors that I was sent from Serenity, two of them were females.
Okay.
The endocrinologist was a female, and the general practitioner is a
Is a
female.
females.
Yeah.
I only see females. I'm sorry. I just
Me
can't.
too.
I'm traumatized from the man who told me you females have too many issues.
Oh
So
yeah.
it's like especially down there, I'm no. So
In the States, I was that way, but out here, because it was referred by someone, and it was, yeah. I think only because of the referral.
Val, I hope you're still here. Thank you. Thank you. This is a new name. And so I just want to give a shout out to Val Little for the super chat. Again, it goes to our scholarship fund. And we do have the challenge coming up, which is in the description. Breast exams.
Yeah, for some
Yes.
reason, even though I'm relatively young, I had a mammogram a couple of weeks ago, because it was recommended by one of the doctors, and it was fine. I mean, it was like I said, the equipment, everything. I've never had one before, obviously, but it was fine. Like, yeah.
And do they use the same machines that hurt?
Yes, and mind you, I have no boobs, so like I was like, how are you guys gonna do this with my little boobs? They managed to, they will manage to get your, even if you are small chested like me, they will manage to get it on that shelf and smush it, and it's
Ooh,
very painful.
It
But
is, but
preventive
so
care, I
necessary.
was like, I'll do it. Whatever is preventive. I don't know
Yeah.
why they
yeah.
recommended I did it, but I was like, well, preventive care. So I think from when I did my gyno visit, they do the breast exam, like the regular, that's with the hand or whatever, and then they recommended the mammogram, so that's why I got a mammogram.
So I
Okay.
just wanted to chime in. I'm sorry, belay my last. I made an error. I was actually looking on the app, the Coof app, to see what prescriptions I had. I actually pulled out my hard copy. It's not gabapentin. I was prescribed gabapentin in the States. Actually, Plaquenil. I was
Okay.
thinking about that I'm prescribed. I'm not prescribed the gabapentin. My apologies. But
Oh,
it's
No.
no, that's okay.
yeah, I
Look,
had to.
I was texting my doctor now. I'll be
See?
emailing.
So, checking on the kids, there is not necessarily a one-stop shop, except for Serenity that, but yeah, in all of these ways that we've said, I've known people who got it through the bank. I've known people who've just Googled, um, in English, healthcare insurance and gotten, some reputable companies. The cost for Serenity is, and we have no affiliation. We're not getting paid for any of this or anything. It's pretty nominal for what you get. It really is. It's under $200 per year. So, if you have pre-existing, if you have concerns, if, speaking the language and all of that is going to make you nervous, it might be worth it. Holistic doctors.
Heather?
Listen, okay, I cannot speak for per se Portugal. I would say I can only speak for Mexico, but I would love to find a holistic doctor here that focused on different methods of treating different ailments. But I do not personally see a holistic doctor at this time.
The insurance that we're getting does mention holistic therapy. So if there's holistic therapy, I would assume that there's a doctor who's going, see what you need.
Yeah.
So, having not, I don't have any pre-existings. I'm very fortunate. Besides hot flashes. But other than that, I'm pretty fortunate. But yeah, so I think that is definitely a thing here. And again, we will double check that with Michael. And no, you do not have to be over 50 to join FIRE over 50. The assumption is that you're starting a little late with the whole financial independence savings thing. And that you might FIRE at 50. So FIRE stands for financial independence, retire early.
I was wondering. I came across the group on Facebook. It was recommended to me, and I felt a little
enjoying. Yeah, because it's
that club yet, so I couldn't join. There's other information.
Yeah, you do not have to be.
Okay.
You do not have to be over 50. You do not have to be over 50. Yes.
Someone is asking if CBD is available or over-the-counter prescription. I want to let them know CBD is so available here. All they have to do is just walk around in Lisbon and Sintra, Mafra, any little town. I mean, the elderly people are on CBD and herbs. They vape it everywhere. It is so available.
There's a store every corner.
Yeah. And please know the difference between CBD and THC.
Yes.
THC will get you high, but CBD is for pain, and CBD will calm you down, and it will help with the pain. There is CBD cream, CBD rub, CBD for eye ache, CBD patches,
CBD tea,
CBD cookies, CBD. But yes, even the football players will put it on them after football games.
I see that on the bus. They were rubbing it all over their faces and stuff.
Yeah. See that there is CBD and there is NFL. There are Portuguese professional football players here. That's 15 teams, and a certain team after they play football, they will put it all over them, and it's perfectly legal.
Yes. So, yes. Yeah. So Govin, I'm not going to say this name because I'm going to mess it up. So you're going to have to watch the replay, sweetheart. We've answered this question twice, and I know it's long. We are going to wrap this up, y'all. I think we did it. Shar, Beverly, Heather. Thank you so much for being transparent, for sharing your stories. A lot of this is very personal, and we do not take that for granted.
Thank you for the opportunity. Appreciate it.
Absolutely.
I will be expecting my breakfast tomorrow. Just throw a rope over to my window, and we can just slide it over.
Wait a minute. You got any of that chicken left?
Me too. I made 2 things.
Just come on down here, guys.
We're gonna make this work, neighbor. Okay.
I will bring you a coffee and pastry when we go out to the cafe across the street and get ours.
Heather,
So I
I
know,
expect my
right?
grits.
Yeah, and I'm still waiting for the grits. Still
The
waiting for the
grits are
grits.
good. The grits are good. Auntie Bev's grits are really good.
No, no,
Yeah.
no. You cook me some grits, right,
Oh,
Sean?
I will cook you guys grits. Yes, for sure.
I love it. I
Yeah.
love it. So, and I went to the Liberty Market. I found the grape jelly, found my maple syrup, but did not find any grits. They have them online, so I guess I'm going to have to order them online.
I have it.
Listen, there are some websites, we'll tell offline, I can't give up all our resources that
That's right.
you can buy the grits.
Okay.
Yeah.
All right.
I have grits
All right.
in the house. If you put some, I could put some in a baggie and give you guys
I
some
even
grits.
have. Look, I even have the biscuits.
Oh gosh. Oh gosh. Okay. Because see, now I'm getting hungry.
Yeah.
We've been talking for a long time. So we have discussed healthcare in Portugal, y'all, a little bit of healthcare in Mexico, but basically the bottom line is that the United States does not have the best healthcare system in the world, y'all. It does not. And it certainly is not affordable. They want you to go broke. We know after this discussion, you'll probably have some more questions. So again, our Black Utopia, Fire Over 50, for those who are from the diaspora, you do not have to be over 50. We talk finances in there and anything that can help you in your move abroad journey. What to watch next. So now that you know how affordable healthcare is and you want to get to Portugal, you want to watch the confidence in investing video that we did the other day, and then planning your scouting trip. So all of that will be in the description after this. And other than that, we will see y'all later.
Yes, thank
Bye.
you for the questions. Hope to see you guys.
Yes, we love y'all.
Yes. Oh, let's